Okay. Hello, good afternoon to everyone. Thank you for tuning in for this lecture. This afternoon, I'm going to talk about the early detection and prevention of stomach cancer, right? I hope you had a good lunch. I shall now start with the talk on stomach cancer. Next, you can have the next slide, please. Sorry. Okay, all right. Talking about cancer in Malaysia, right? You know, cancer is the fourth leading cause of premature death in Malaysia, and it's estimated about 90 to 100,000 people in Malaysia is living with cancer at any one time. Okay, so by the age of 75 years old, about 1 in 4 people will develop cancer. So it's going to be a big problem. Okay, and the good news is that 40% of all cancers are preventable, okay, including stomach cancer, okay. And the improvement in early detection and treatment leads to better survival, all right. And that's the reason why we should be screening and fighting for the cancer, right? So my focus today on stomach cancer is on how to prevent and how to detect the cancer early so that we can improve the survival of the cancer, right? First of all, how common is stomach cancer, right? Stomach cancer, in terms of, it varies in the geographical location, right? You can see here, this is the world map of the incidence of stomach cancer. The one shaded in dark blue here, right? The incidence rate is about 11, which is 11 per 100,000 population per year incidence. It's very high. You can see here in Eastern Europe, in China, Japan, Korea. You can see this region here, okay? Very high. And it's low in areas like North America and Australia, okay? Almost 40% of cases actually occur in China. So, and China and Japan has a very high incidence, okay? This is how common is stomach cancer worldwide. The latest statistics in 2020, according to Global Scan, lung cancer is number 1 cancer, followed by prostate, colorectal, and stomach cancer is number 4th cancer, right? So it's the 4th most common cancer in the world. But in terms of causing cancer-related death, it is the 2nd most common cause of cancer-related death. And as I mentioned, it is very high in places like Japan, Korea, Latin America, USSR, and low in places like USA, Canada, and Israel. Okay. What about in Malaysia? Well, these are the 10 most common cancer among males in Malaysia, right? We can go, if we go down here, colorectal cancer is number 1, but stomach cancer is the number 8th cancer, right? Among males, all right? And 10th cancer among females. This is in 2007 and 2001 National Cancers 2011 National Cancer Registry. The 2012 until 2016 National Cancer Registry, very similar figures, okay, in terms of stomach cancer. It is slightly lower, not 3.9, but it's about 3.4, slightly down, okay? The incidence is coming down a little bit now, per 100,000 population, right? Okay, so the good news is the stomach cancer is actually decreasing, but the bad news is that it is still diagnosed very late here. You can see in this graph I show you, this is the stage of the stomach cancer when it is diagnosed, when the patient presents, okay? At diagnosis, this is the figure, this is the chart I show you. In Malaysia, for all residents, in the year 2007, we can see that the majority of the cancer at the time of diagnosis is stage 4, 48.7%. Whereas stage 1 only accounts for 8.5%. So we are diagnosing cancer very late, okay? So stage 1 only 8.5, but majority stage 4. So that stomach cancer is diagnosed very late, okay? What about, are we doing better? The bad news is that actually we are even doing worse, okay? This is stomach cancer among males, all right? From the year 2012 to 2016. You can see here the majority, stage 4 stomach cancer, most of the cases still diagnosed very late, 51%, okay? So we are actually not doing well, still after so many years, from 2007 until now 2016, we have not actually improved. The diagnosis of stomach cancer is still very late stage diagnosis. That's the reason why we have to educate the public about the early detection and how to prevent stomach cancer. Okay, this is the statistics in Penang. How are we doing in Penang? Gastric cancer incidence, this is the incidence of stomach cancer in Penang among the various races, okay? Malays, Chinese, Indians, this is on the males, and this is the female. We can see here that the periods between 1994 to 1998, okay, male Chinese were the highest, Indians were highest, then followed by Chinese. But as you can see here, from the year 2004 to 2008, the Chinese race actually is highest among the Chinese, compared to less so in Indians and the least in Malays, right? So being the Chinese race, actually is a risk factor, okay, for stomach cancer. That is for among males. Females is the same. You can see here that the Chinese has the nearly, Indians and Chinese about the same here, has got a very high incidence of stomach cancer compared to, for example, the Malays, right? So what are the risk factors? One of them, as I mentioned, is ethnicity, which is the race. But there are other important factors. I think the most important factor is actually H. pylori. This is the bacteria in your stomach. I'm sure you all heard about Helicobacter pylori, right? Okay. Since its discovery in 1983, okay, stomach cancer, we know that has been associated with this bacteria. This bacteria has been known to cause gastritis, duodenal ulcer, stomach ulcer, and also stomach cancer, right? So I'll be talking a little bit about this bacteria later on, but this is the number one risk factor. In fact, the WHO has classified this H. pylori as a definite carcinogen, right? Now, the other age factors are tobacco, diet. I talk a little bit later. Precancerous changes like intestinal metaplasia. These are the changes or dysplasia changes before the stomach cancer, right? And of course, the older you are, you are increased risk of developing stomach cancer, and some genetic factors as well. Okay, family history of stomach cancer, and some polyps, not all polyps, right? Okay. What about the risk factor in Malaysia, right? Dr. Lim, who actually is a surgeon, actually working in Taipei, he has published a very good review on the gastric cancer research in Malaysia very recently, in this cancer prevention, on the Asian Prevention of Cancer, Journal of Prevention of Cancer in 2019, and he has these are the factors that's been identified to be independent risk factors for gastric cancer. We can see here high intake of salted fish and vegetables. I think they may be the reason why the Chinese tends to take a lot of salt, especially in the diet, salted fish. In Hokkien, we say giam hu and giam chai. Okay, So we like this salted fish and vegetables, and this has been identified as a risk factor, in fact, for stomach cancer. The other thing I mentioned is the H. pylori, the stomach germs, there's bacteria in the stomach. Smoking, if you're a smoker, you're a risk factor for stomach cancer. And low level of education, they found that. So in those low, especially in the lower socio-economic group, and also in the Chinese race, right? So these are the risk factor for stomach cancer. Okay, tobacco, we know smoking causes other cancers as well, including lung cancer and also stomach cancer. But the risk factor for stomach cancer is increased actually about 50 to 60 times if you are a smoker compared to a non-smoker. So it accounts actually for about 11% of all stomach cancers in the world. Just smoking tobacco is a cause for that. Now, what about food? We'll talk about the diet. Okay, and I'll talk a little bit about certain diet which are bad for you in terms of giving you increased risk. It doesn't mean that if you take this sort of food, you will get stomach cancer. But then people who take a lot of this type of food, like processed food, salted food, and preserved food, pickled food, they are bad like this. All these pickles food, I know mangoes are all very nice, but then pickle fruits are not so good. Okay, so we should be taking less. Salted food, for example, we like to put a lot of salt. It's not only good, it's not only bad for stomach cancer, but also salt is bad for hypertension as well. So we should be taking less of this food. Smoked food, okay, including processed food like sausages, are not good. Okay, so you should be taking less. Okay, what sort of diet helps to protect you from gastric cancer? Okay, food like fresh vegetables and fresh fish, fresh fruits. Now, important and very interesting diet is the chili. All right, you all think that most of us think that chili is actually bad for your stomach, can cause gastric and symptom all this. But actually, if you examine, people have actually done research on on chili and actually curry. The curcumin, which is a very important ingredient in the turmeric powder, which has been used for making curries. We know that the Indians and the Malays race, they tend to take more of this curry, and that's why this may be one of the reasons why they are protected in a way from stomach cancer, because of this ingredient called curcumin, which is present in the turmeric powder. Okay, so this somehow helps to protect. It's a protective factor for stomach cancer. Now, low intake of preserved food, of course, if you because in the olden days, before the advent of refrigerator, we know that people tends to take a lot of food had to be preserved, and that's the reason why they don't take so much of fresh food, and the reasons for the incidence of stomach cancers in very high those days. Now, because of refrigeration, the incidence of stomach cancer has come down. Okay, what are the foods that actually helps to prevent, have got anti-cancer properties? I'll just show you a few of those important, what they call fruits and vegetables that you should be taking more, because it has got anti-cancer properties, like turmeric, blueberries, strawberries, green tea, soya beans, tomatoes, okay, grapes, citrus fruits, in fact garlic and onion as well, okay, and cabbage and broccoli, right? These foods contains what they call phytochemicals, which has got anti-cancer properties. I'll talk a little bit about the benefits of tomatoes, right? Okay. I didn't realize that tomato has got so much of benefit until recently when I have to do a bit of research into tomatoes. I find that actually it has a lot of benefits, including antioxidant properties, reduce the risk of stomach and kidney and also prostate cancer, and it also helps to protect vision. by decreasing the macular degeneration, okay, and helps in preventing, it's good for against heart disease and even neurodegenerative disorders like Alzheimer's disease, okay. So it has got antioxidant property, and is the ingredient that is responsible for its benefit is lycopene, okay. Another fruit which I like to emphasize is the avocado, right? You know, avocado, this fruit helps to protect against cancer and other dangerous disease, okay? It contains a lot of vitamins, more than 20 vitamins and minerals, okay? Important thing it contains is that it contains monosaturated fatty acids, MUFA, okay? And also it has phytochemicals, okay? Um, Moreover, it also has antimicrobial activity. That's why it's got a natural, it acts as a natural probiotic, you know. Um, but it has been shown that to protect against many cancers, including stomach and colon cancer, also prostate cancer, pancreatic cancer, even cervical cancers. And it's due to these monounsaturated fatty acids. It helps to even reduce LDL cholesterol and increase the good HDL cholesterol, increase insulin sensitivity, okay, even improve your vision, yeah, and also improve bone health, okay. Next is garlic and onions. You know this, even before Christ, before 2000, garlic and onion has been well documented to play a very important role in the treatment of disease. During those times, we don't have any medication. We only rely on all those natural product, food and fruit. So garlic and onions has been shown, in fact, to be capable of even slowing down the propagation of cancers by interfering with the growth process in cancer cells. So um, it provides a good source of anti-cancer properties, compounds. So eat plenty of garlic and onions, right? Fresh fish, right? Not the small fish. So a lot of these fresh fruits like this, okay? Just to remind you, variety of fresh fruits, very important. Okay, green tea, right? Green tea um, is supposed to be beneficial in preventing stomach cancer because of this. It has got this anti-carcinogenic property. The in polyphenols, you know, green tea has a lot of polyphenols called EGMC, and has been shown to inhibit many cancers in the body, including lung, breast cancer, ovarian, stomach, and skin cancer. Right. This slide shows you that the active ingredient in green tea is called EGCG, which is a compound. It has got anti-cancer properties. And if you compare the green tea with, for example, Chinese tea, green tea has got more of this EGCG component. The next factor I'd like to talk about is Helicobacter pylori. Okay, as you all know, this was discovered in 1983 by Warren and Marshall, and after that, they won the Nobel Prize for discovering this bacteria. And after discovering this bacteria, the then we know that a lot of ulcers and gastritis are caused by this bacteria rather than by acid. We used to think that the acid is the culprit. If there's no acid, there's no ulcer. But actually, the reason why we get ulcers, stomach ulcers and duodenal ulcers, is this bacteria called Helicobacter pylori. So that's the reason why those days when we treat ulcers, it tends to come back because we only use medication to reduce the ulcers. So, but the H. pylori is still there, and we couldn't cure ulcers. But now, with the discovery of this bacteria, we know that we can cure gastric and also cure duodenal ulcers if we can get rid of this bacteria in the stomach. And more important so is that this bacteria has been associated with stomach cancer, all right? The WHO has now classified this as a group 1 carcinogen. Okay, so those people who have this stomach, this bacteria in their stomach, has about 2 to 6 times increased risk of developing this stomach cancer compared to those without this bacteria. And so it is really important to actually screen the first degree relatives, like brothers, sisters, or parents of patients with this bacteria, okay? Because of the, this is commonly, but this bacteria is commonly spread within the family, okay? It's from person to person. That's how it's spread, okay? So close contact within a family, usually during childhood. Okay, how does this bacteria cause stomach cancers? Okay, it acts here. Okay, in this natural. This is a natural history of developing stomach cancer. You can see here at this level. Okay, Helicobacter pylori actually affect the stomach and causes what we call chronic inflammation, chronic superficial gastritis. And together with a diet which is low in antioxidants like vitamin C and E, and a high intake in salt, together with this bacteria, you actually this leads to development of this chronic inflammation of the stomach, which then leads to thinning of the stomach called atrophic, and then intestinal metaplasia, which is a pre-malignant condition of the stomach, and finally to dysplasia and cancer, right? So that is the natural process. Now, why do we know that this H. pylori is so important as a risk factor for stomach cancer? This graph shows you the risk of stomach cancer after we get rid of the bacteria, after we get rid of this H. pylori. This study was done over 1,000 over patients, initially in China, and patients that were got rid that they had H. pylori infection initially, but that managed to be successfully H. pylori successfully eradicated. They will follow up for at least 10 years. You can see here, and now in fact the follow up has been extended to about 20 years. This is the percentage free of gastric cancer, the risk. You can see here over the years as you follow up, the risk decreases every year. Okay, once you get rid of this bacteria, okay, and then even up to 12 years, you see the risk is really reduced. So this shows that indirectly the cause of stomach cancer is highly related to H. pylori infection. Okay, how common is this bacteria, H. pylori status in Malaysia? Okay, you can see here that among those gastric cancer patients, okay, the H. pylori infection has in fact come down. Okay, from 1989 to 1990, it was 43%, but in 1999 to 2000, it has come down to 37%. Okay, and also the rate has come down in H. pylori infected patients who have undergone endoscopy. They found that the 1989 to 1990, this period was 52%. That means among all those patients who had undergone endoscopy, this study was done in Kuala Lumpur, University of Malaysia, Kuala Lumpur. And the year 1999 to 2000, it has dropped to about 30%. So the rate of H. pylori has decreased. I think this is the main reason for this is because of the improvement in hygiene and also in the social economic status. Now, this chart shows you the incidence of the prevalence of this H. pylori among the three races. We can see here that the Indians have the highest compared to, next is Chinese, and then the Malays. Malays have the lowest H. pylori prevalence in cancer patients, all right, in patients with stomach cancer. Right, now we comes to clinical manifestation. How do we know what are the symptoms of stomach cancer that we can look out for? Okay, what are the signs and symptoms? so that you can pay attention to if you do have these symptoms. All right. Now, it all depends on whether you're talking about early cancer or late gastric cancer. For early gastric cancer, actually, majority, 80%, don't have symptoms. So if you say about symptoms, to rely on symptoms to diagnose early cancer, I'm sorry, you are likely to miss early cancer, because early cancer, you don't have any symptoms. Okay? Now, maybe about 10% will have a bit of pain over the epigastric pain. Okay, this epigastric pain is like an ulcer pain, which is typically when you get hungry, and is sometimes relieved after a meal. Okay, and can often occur at night. Okay, especially when you're hungry. So epigastric pain, nausea and vomiting, about 8%. Okay, uh, okay, this is an important symptom to look out for. Anorexia or poor appetite. Uh, Patients with early cancer, stomach cancer, suddenly they lose their appetite. If you give, let's say, if they like durians, for example, and then suddenly you find that have a you have no appetite. Even the food is looks nice. Even if, for example, you be the best food that you like, your favorite food, suddenly you don't have the appetite to eat this food. Okay, this loss of appetite and loss of weight as well, but loss of weight is actually a lower, a later symptoms. Okay, another symptom to look for is early satiety. That means if you're not able to finish your meal, okay, say three-quarters of the meal, after eating, you feel like you're full already. You feel like stopping. You can't finish the meal. Okay, so that is another symptom you have to look out for. Pain. Well, when you usually early symptoms, you don't have pain. Pain can be due to gastric ulcers, okay, or malignant or ulcerated tumor, okay, they can cause pain. Vomiting blood, yeah, this is a very serious, okay, I think, call it alarming sign, a red flag sign, or a symptom. That means you vomit out either blackish, like coffee ground vomitus. This is because the blood is not normally red in color, but after mixing with the acid in the stomach, it becomes blackish. So when you vomit out like coffee ground, we call it coffee ground vomitus, and that is a sign of bleeding actually, in your stomach. Okay, then maybe the doctor may find a mass, or you may find a mass probable in your tummy. Okay, and that usually it means that there's a growth there already. Okay, now, so these are all the symptoms. These are the advanced, for advanced stomach cancer. You have weight loss, nausea, vomiting, anorexia, difficulty in swallowing, because the food cannot enter the stomach, right? Because of the a growth here, usually, okay, this part of the stomach. So you have difficulty in swallowing, okay? The food cannot enter into the stomach. And bleeding as well, okay, from the tumor. And sometimes when you pass stools, it becomes blackish in color because of the blood in the stomach, which has been mixed with the acid. It becomes blackish, and that's why when you pass stools, it appears blackish in color. You know, some people have this feeling of fullness. Okay, fullness means after just eating a little bit, you don't you feel very full, epigastric fullness. It's because usually there's a growth here, and the food can take a long time for it to actually enter into the small intestine, and because of that you feel very full. So it may be one of the symptoms of actually stomach cancer. So these are the symptoms you look out for. Next, I want to talk about is okay, how can you diagnose this stomach cancer? What are the investigations? Okay, one test is called a barium meal. Okay, where you will swallow a whitish contrast, call it the barium, and then you take pictures. Okay, there also you can see here, for example, this is a barium meal showing you the cancer of the lower end of the stomach. You can see here there's a narrowing, okay, due to cancer. Okay, so this is stomach is grossly distended, okay, because of the growth here. Okay, So we can take X-rays, but the disadvantage of taking this barium meal is that you cannot take a biopsy. Okay, so you have to go to do an endoscopy so that you can see the lesion, and also you can take biopsy to confirm. All right. So that is the advantage of doing what they call endoscopy. Endoscopy is pressing a flexible scope down, okay, an endoscope down your stomach, esophagus, and the stomach, okay, and then it will show you this is a procedure called endoscopy, which I do every day. These are my two nurses, okay, and we can see here that this is a screen here. You can see, and then you can also have direct look into your stomach and take biopsies if necessary, and we can also do treatment therapy. We call it therapeutic endoscopy by removing polyps, by removing by taking samples from the taking tissues from your stomach. All right. So this is, for example, showing you that the polyps, a lot of polyps have been taken out from the stomach. Okay. Okay. So this is the advantage of doing the endoscopy. Okay. Okay. This is a picture of a very advanced cancer. You can see here a very nasty growth here. Okay. This is a very advanced cancer. Okay, we take biopsies. This patient had actually confirmed to have stomach cancer. This is another picture showing you that this is a big growth here in the stomach. Okay, this is stomach cancer on endoscopy, and this actually is a very unlucky patient. Sometimes you can have both a stomach and a colon cancer. So this patient, a very young patient, Indonesian patient, which I saw many years ago, and she was very unlucky. She found to have not only a stomach cancer here, you can see here, and outside the stomach, but when you do the colon, she also had a cancer in the large intestine at the same time. Okay, all right. Usually, when we diagnose the patient to have stomach cancer, the first thing patient always asks is that, doctor, what stage is it now? We are very worried because the stage is very important. Okay, whether it is early stage or late stage, because this can determine whether you live or you're going to die. Okay, so for early stages, for example, stage 1 or stage 2, okay, there are altogether 4 stages of the stomach. The first stage is when you have a cancer here, for example, okay, it is just confined to the lining, the mucosa. Okay, this is stage 1. But if the cancer has gone through into the muscle layer, okay, but has not come out of the stomach, still within the stomach wall, is called stage 2. Stage 3 is when the cancer has gone through the wall of the stomach, through the muscle layer, and also affect the lymph nodes, the surrounding the lymph nodes. Okay, this is called stage 3. And of course, stage 4, it has gone or spread to the nearby organs, very often the liver, because the liver is actually very next, just close to it, or the lungs higher up. Okay, so these are the 2 organs that the stomach cancers tend to spread, and if that happens, then it's stage 4. This is a bad news. Okay, very advanced cancer, right? So this graph shows you the survival rate. When we talk about survival rate, we talk about a 5-year survival rate. That means if you are able, for a normal person, okay, to survive 5 years, okay, if you're able to survive 5 years, then that determines that you are likely to survive, to be cured of the tumor, right? So we call about 5-year survival rate. Okay. At the time of your diagnosis, this actually is in Japan, where the 5-year survival rate is very good because they are very aggressive in their treatment. They detect cancer very early, and also their surgery is very advanced for stomach cancer, because the stomach cancer rate is very high in Japan, and everybody gets screened for stomach cancer. You can see here overall, the 5-year survival is, if you have stage 1, is almost like 90%. So very good survival. Whereas if you got stage 2, it's about 70%, and if you're stage 4, it's very bad, less, about 10% only. So the stage of the disease at the time of diagnosis determines the prognosis. All right. Okay, I'll talk a little bit about the treatment, but I will not. I will show you the 2 cases to illustrate you the different treatment of stomach cancer. Depends on at what stage. But just to let you know that in order for the cancer to be cured, okay, surgery is the main option. There are other options like chemotherapy, radiotherapy, immunotherapy, and targeted therapy. Okay, these are mainly for what they call palliative treatment. Okay, for if you want cure, sometimes we do surgery not only for cure but to palliate the symptoms, you know, to make the patients, for example, the patient not able to eat or what, you know, sometimes we put do a surgery to actually make the patient better, okay, although we can't cure the disease. But I would like to show you back to back two recent cases, one early cancer and one late cancer. Okay, this is the first case I saw recently, Mr. A. I call him Mr. A. Again, you see a Chinese gentleman here, okay? Chinese, 62-year-old Chinese gentleman. What was his complaint? When he came to see me, 3 months, for history of about, in 2020, December 2020, we were complaining of loss of appetite and loss of weight for 3 months, okay? And he also complained of difficulty in swallowing, both solids, and he vomited on the day he came to see me, vomited. And also he had a bit of chest discomfort and epigastric pain and bloating, all right? Social history, yeah. Okay, somebody very nicely put out the beer and the cigarettes here. He was actually a smoker, okay, and also a drinker. But he didn't drink this, he drank Guinness Stout actually, all right? But he stopped about 1 year ago, okay, before the diagnosis. So this is the risk factor, I think, one of the risk factor. And when I saw him, he looked very thin. And there was slight tenderness just over the over the epigastrium. The liver and their other organs were not palpable. Okay, there was no mass. But when we do the endoscopy, you can see here that the cancer is very advanced already. See, this is all cancer, right? Okay, all right. And this is, you can see here that the food, there's a lot of food actually residue in the stomach because the food cannot go down. It's all covered with tumor here. Okay, that's why it's been vomiting. All right, this is very advanced cancer. And sure enough, if you take a biopsy, the biopsy confirmed adenocarcinoma of the stomach. Okay, right. So the diagnosis was that of gastric cancer. Unfortunately, it was so we had to do a staging to see how far the cancer has spread. You know, so when we did the scan, it said there was a diffuse wall thickening of the lining of the stomach, suggestive of cancer, and some lymph nodes were found. Okay, but then they didn't pick up any spread of the tumor to nearby organs like liver or lungs. Okay, so probably it's about stage 3, and that's why he was offered surgery. Okay, so during all surgery, however, unfortunately, there was a small metastasis, we call it. The tumor is very advanced already and has also spread to one part of the liver, which has to be removed as well. Okay, and you can see here that this is during surgery, that this the tumor has developed into an ulcer, right? Okay, there's a big ulcerated tumor, large ulcer, who has been removed. And this was a final diagnosis that actually will turn out to be actually stage 4B because of involvement of the liver as well, and lymph nodes, all right? So after surgery, he was referred to the oncologist and had chemotherapy in PNGH, and then after that he was able to eat normally, right? After the surgery, he was able to eat normally. But then just at the beginning of this month, September, he saw me complaining of difficulty in swallowing and vomiting. So there's a suspicion that the cancer may have come back. So sure enough, when I did the endoscopy, there's recurrence of the stomach cancer, all right? And you can see here, this is the part that's been resected, the joint part, okay? We call it anastomosis, where the stomach, this has been all been removed. The patient had a total gastrectomy, that means the whole stomach has been removed, and the small intestine joins to the esophagus here. This is the junction where the esophagus has been joined up with the small intestine. And at this junction here, you can see this tumor has recurred, okay? And the lumen is very small. That's why he has difficulty in swallowing. The food cannot pass through, okay? So I had to put a stent. The next day, on the 2nd of September, I put a stent here. You can see the 2 clips to hold the top. This is the top end of the stent, okay? This is inside the stent here, you can see here, all right? The stent is just it is about 6 centimeter long, okay? This is the top end of the stent, and this is, you can see here the narrowing here, okay? This is where the tumor is. And this allowed you to eat so that the food can go through the stomach, okay? And goes down. so that you can eat again. All right. So with after the stent was able to eat. All right. So and then he had to resume his chemotherapy as well. All right. So unfortunately, this is a very advanced case. So next case I want to show you direct contrast, back to back, really. Okay, it's again a Chinese lady, 67-year-old Chinese lady. Way back this year in March, okay, she was admitted to another hospital, private hospital, and just for a knee operation. And during the investigation, they did some blood tests and also some stool tests, and they all found to have some blood, occult blood, not seen, but they detected some blood, trace of blood, because she was slightly probably anemic. And they found that the cause for this presence of blood in the stool is that he has got an ulcer in the stomach. They did an endoscopy and found an ulcer, and the biopsy, however, from the gastric ulcer showed that this was in fact cancerous. All right. So when he came to see me for a second opinion, right, this is before the surgery. I did the scope and to confirm, yes, in fact, there's an ulcer here, and then you have to do a tattooing. We tattoo it with the betadine blue so that the surgeons can identify it when they do a laparoscopic removal of the cancer. Okay, uh, this is after the tattooing, and the biopsy in fact confirmed that it is a signet ring carcinoma. Uh, Before the operation, we did CT scan. There was definitely no involvement of the. It was operable. We know there's a very early cancer, right? Okay, either stage 1 or stage 2. And sure enough, during operation, there was only a stomach, a gastric, very early gastric cancer. Okay, ulcerated as an ulcer. Okay, and patient underwent subtotal, not the subtotal gastrectomy. Okay, just involving half of the stomach. Okay. And the final diagnosis is that she was very lucky because she was only in stage, the cancer was detected at a very early stage, stage 1A, all right? And there was no lymph nodes. Out of the 7 lymph nodes that were removed, none of them were involved by the tumor, okay? So the patient had the cure over there of the stomach by the surgery, completely excised, okay? And the margins were clear of the tumor, okay? She recovered very well, and she saw me lately again. There were no symptoms at all, right? She were. So this is early cancer, and you can see that prognosis was different. Okay. Um, so the take-home message is that lifestyle changes is very important. Okay. How can we prevent? I talk about prevention now. The prevention of stomach cancer. Diet and lifestyles are the changes that we can do, okay, to prevent the disease. First of all, talking about diet, what sort of diet you should take? You should take a diet that is high in fruits, fresh fruits, example, and fresh vegetables in the diet, okay? Take more of this. Don't smoke. Do regular exercise, because exercise has been shown to improve or prevent not only stomach cancer but other cancer like colon cancer and so forth. Okay, reduce the salt intake in your food. Okay, don't put too much salt. Okay, it's not good for your blood pressure as well. Okay, and if you are overweight or if you are diabetic, control your blood sugar and your weight. Very important. Controlling your weight, I think a lot of people can lose weight, but I think it's difficult to sustain, to maintain the weight loss. Now, avoid taking fatty processed meat. Processed means, I mean, like a lot of sausages and all that. These are processed hamburger. All these are processed meat. It's not good. Cut down on the smoked and preserved food, like those pickled foods and so forth, smoked food. All right, but you take more of fresh fruits like avocado and blueberries, as I mentioned. Okay, garlic, tomatoes, right? Turmeric is found in curry. So you take a lot of curry is good actually, because it helps. That's the reason why I think stomach cancer, right, is less common among Indians and Malays, because they take more curry than the Chinese. Because Chinese tend to take more salt in the diet. So I think this is one of the risk factors why stomach cancer is common among the Chinese race. And this is something we can do. Okay, your eating habits or diet we can alter. All right. Now, don't forget that this bacteria H. pylori, you must screen for it, okay? Even though you don't have symptoms, if your first degree, especially if your parents or your brother, sisters got this H. pylori infection, okay? You must screen for this bacteria. You can do either blood tests, you can do even breath tests nowadays, okay? Non-invasive tests, okay? And if found to be positive for this bacteria, it's very easy now to get rid of this bacteria by taking a 2 weeks course of antibiotics. And once you get rid of it, it seldom comes back. Only about 5% will come back. So we can cure this bacteria. If you can cure this bacteria, your risk of getting stomach, if you can prevent stomach cancer. Okay, avoid taking painkillers like Bongsan or all this, which is not good. It can cause bleeding sometimes, you know, and also it's not good for stomach cancer, right? So, ladies and gentlemen, this is my last slide. Okay, I'll just share with you a joke. Okay, one day, a doctor asked the patient. He said, "Why did you take your antibiotic so late? I asked you to take at 6 p.m. and why did you take? I told you to take at 9 p.m. But the patient took the antibiotic at 6 p.m. So the doctor said, "Why do you do that?" The patient replied, "I wanted to surprise the bacteria. That's why he took at 6 p.m. instead of 9 p.m. All right. Jokes aside, all right, it is very important as a patient to always listen to your doctor, okay? If your doctor advises you to take the antibiotic, you must take the antibiotic and finish the 2 weeks course of antibiotic, especially for this bacteria in the stomach called H. pylori, because especially the first time is the best rate of getting rid of the bacteria. After you fail the first time, then the chances of getting rid of the bacteria actually decreases the more times you take the antibiotic. So it's very important to emphasize that you must follow the doctor's advice, all right? And don't try to be smarter than the bacteria, all right? So with this, I'll end my talk, and I'll be happy to entertain any questions. This is the Q&A section. This is an opportunity for you to ask questions if you have any. All right, thank you. Oh, I already got questions. Okay, okay. I have, okay, the question is, I have ongoing GERD issues for many years and recent done endoscopy and colonoscopy. Luckily, let me read, where is it? Okay, luckily no tumor or cancer detected, okay, except for polyps that were removed. Question is, how long can I wait before I have to do the screening again? Okay, this patient says that he had endoscopy done and had polyps that were removed. I presume that the polyps were removed from your colon. Let's say if the polyps has been removed from your colon, your next screening can be about 3 years. Let's say if your colon is clear, you can even wait 5 years, you know, before your next screening. Okay, but because you have polyps, it's better to do it earlier. You know, I would recommend about 3 years with your next screening. The next one. If we always have gastric problem, does it mean we will have higher chance of getting stomach cancer? Oh, it all depends really what your gastric problem is. Let's say if you have this bacteria in the stomach and it's causing gastric ulcer and gastritis even, if you get rid of the bacteria, then your chances of getting stomach cancer is low. But if you have the bacteria but you didn't check for it, or you didn't have treatment for it, or you can't get rid of the bacteria, then definitely you have a high chance of getting stomach cancer. I can tell you that. All right? Okay. Which one? Another question is about what are the early symptoms of stomach cancer? Okay, just now you pay attention to my slide. The earliest symptom is actually no symptom. Okay. This is, unfortunately, once you have symptoms, it's quite often too late, you know. Usually this cancer, when it presents very early on, it doesn't cause pain, you know. It doesn't, unless, you know, it's become ulcerated, you know, like this patient I showed you earlier. If she didn't have ulcer in the stomach, we wouldn't have detected the cancer. So early symptom, unfortunately, no symptom. But if you're looking for specific symptoms, I would say you pay attention to some of the symptoms, like, okay, if you pay attention to the symptoms, one of the early symptoms is actually loss of appetite. So if you have lost of appetite for food, okay, then you should see a doctor and say, why suddenly, don't wait until you have lost weight. Those people who have lost appetite, usually because they do not eat well, then they lose weight as well, okay. So weight loss is actually don't wait until you have significant weight loss to see a doctor. Once you have lost your appetite, you should go and see a doctor. So I would say you should look out for this early symptom. All right. Any other questions? No other questions. Okay. Huh? So you want to ask? No more. Huh? Okay. If okay. Maybe one of the reasons, maybe one of the questions that has been asked is uh, which I showed to you earlier on, is that uh, in Malaysia you find that the Indians have a very high prevalence rate for H. pylori, this bacteria in the stomach. Okay, in fact they're the highest, but yet the Indians are protected in a way. They don't. It's only the Chinese that get the stomach cancer and not the Indians. This is what we call it the Indian enigma. And it's the same in India as well. Okay, when they did studies, similar things. The reason I think is, which I personally think is the diet. It's a protective factor. Is they take a lot of curry, and the curcumin, the turmeric, seems to be the protective factor, okay, in the curry that helps to protect them against this stomach cancer. And that's the reason why, even though they have a very high incidence of H. pylori among the races, their cancer rate is not as high as compared to, for example, Chinese, right? Okay, next one. Is the urea breath test reliable? If not, what test should one do to check for H. pylori? Yes, the urea breath test is very reliable test. Okay, you should do a urea breath test to detect whether you have eradicate the bacteria or not. Okay, you don't actually need to undergo an endoscopy, more invasive test. The urea breath test is very accurate. Okay, but the important thing to remember is that you must do the test 1 month, okay, after you've completed the antibiotics, not earlier than that, right? So the test, and then you have to dump the empty stomach, and you make sure you don't take any anti gastric medicines like PPI, proton pump inhibitor, that reduces the acid, because you have to stop this medication 2 weeks before the test, or else you will give a false test, because there's this medication reduce the acid in the stomach, and even though the stomach the bacteria is present, the urea breath test may not be able to detect it. Okay, so should one do an annual H. pylori test? There's no need to do every year. If you do a H. pylori test negative, it is unlikely that you will acquire this bacteria. Maybe people like me, I do scopes every day, get exposed to a lot of patients with bacteria. Maybe occupation, because of my occupation, I should do more often. But no, we wouldn't recommend that you do a H. pylori test every year. No, there's no need to do that. Like that. I have done the endoscopy and colonoscopy under your hands in 2017. All right. But I have stomach discomfort again. And after a year later, hits me on and off till now. What should I go for screening again? That was 2017. That was about 5 years ago. Okay, it all depends on your symptoms. If you just have pain, it depends on your symptoms, right? If you have pain, and depend on what's the finding earlier, okay? If you have ulcer, for example, something serious, okay, and you have this pain again, it may be that you are taking some medication which can predispose you to this stomach cancer, that means stomach ulcer, then you should do another scope. For example, if you are on antiplatelet agent for ischemic heart disease, then or you're on painkillers, right? If you're taking any painkillers for your arthritis, for joints and pain, then if you have this epigastric pain, then we should, if you suspect you to have ulcer, then you should have a gastroscopy done again. Gastroscopy, I think, right? So it all depends on your symptoms and what's your findings earlier. Okay. Can the antibiotics be taken for prophylaxis? Oh no, you can't take antibiotics for prophylaxis just to prevent this infection. No. Once you take this antibiotic for prophylaxis, you're going to end up in problem because you can develop resistance, and actually when you have this bacteria, once you develop resistance, it's very difficult to get rid of. So those patients who undergone the first time, they got resistance to this antibiotic. If you use the same antibiotic, your resistance rate can be as high as 80-90%. So we have to change the antibiotics. So we have to use a different antibiotics from the first one that we use. Okay, so I wouldn't recommend you take a prophylaxis antibiotic to prevent this bacteria. Okay, if you were found to have H. pylori and underwent treatment, is it advisable to do colonoscopy also? Well, okay, H. pylori and does not actually affect the colon, although it is found in the feces, but it doesn't cause any disease there in the colon. Okay, not because of H. pylori that you would need to undergo colonoscopy. No, but if you have other symptoms that require colonoscopy or past blood or change in bowel habit, then yes, then you will need a colonoscopy. All right. Oh, no more. I think I've answered all the questions already. Okay. Okay. So I think I will close this session since there are no more questions. And I hope you have enjoyed this talk. And I would like to thank all of you for tuning in, and hope you have benefited from my talk. Thank you.